1199 SEIU is on the move. Our members have achieved many great victories over the last year in the community, at the State House, at the bargaining table, and in growing our internal leadership. In the past year, we have filled hundreds of open delegate and leadership slots. We held a swearing-in ceremony on July 23rd to welcome our new delegates. 157 new delegates went through training. 25 delegates attended problem-solving workshops, and 26 attended contract interpretation training. The Leadership and Training Program was expanded to all three sectors: health systems, long-term care, and personal care attendants. Meanwhile, delegate assemblies have expanded beyond Boston and Cape Cod to Lynn, Amherst, Brockton, Holyoke, Worcester, Lawrence, Springfield, and Fall River. Union members participated in political leadership academies and legislative leadership academies to strengthen our voice at the State House. Following a union-wide election of new officers and delegates, the 1199 SEIU Mass Advisory Board became the 1199 Mass Executive Board. The Executive Board will represent our division to the 1199 SEIU Executive Council. Members elected to the Executive Board include Cynthia Bates from St. Elizabeth Medical Center, Carrie Rivera from Boston Medical Center, Andrea Smith dos Santos of Brandonwood of New Bedford, Tammy Lawler of Cape Cod Hospital, and Denise Lechenier, PCA. As our internal member and delegate strength grew, we took on tough fights at the bargaining table and proved we could win in tough times. At North Adams Regional Hospital, union members were engaged in a tough fight with management over a successor contract. After several months of tense negotiations and a strike authorization vote, 1199 SEIU members were able to preserve our contract with little changes. Shortly after our last delegate assembly, 1199 SEIU members at 4 Caritas Christi hospitals, Good Samaritan Hospital, St. Elizabeth's Medical Center, Kearney and Norwood Hospitals, reached a historic labor agreement with management. The Caritas Master Contract, which was ratified overwhelmingly by members, provided significant wage and benefit improvements and access to the Training and Upgrading Fund for nearly 3,000 1199 SEIU members. At Northampton Nursing Home, union members were able to overcome a contentious battle with management. The home was under threat of new ownership as the facility was about to be sold to Samuel Pinter, an unscrupulous Brooklyn-based real estate developer who threatened the staff with layoffs and a reduction in quality of care. Members at Northampton prevailed and saved their jobs and the home by rallying political and community support to their side. Members at Jordan Hospital in Plymouth recently ratified a new agreement with management after several months of struggle. Members mobilized against health insurance giant Blue Cross Blue Shield, who was threatening to destroy reimbursement and funding for the community hospital. Union members boldly delivered a petition to Blue Cross executives and told them to stop jeopardizing care delivery at the facility. In Boston, nurses and Unified Unit members at Boston Medical Center were able to extend their contract in the face of major financial challenges at the hospital. Our contract helped protect members from layoffs, and together we kept our contract protection intact through bargaining. On the state and national level, members fought for healthcare reform. Thanks to our impact on statewide health reform, Massachusetts is #1 in the nation for health insurance coverage, with 96% of our residents insured. 1199 SEIU members at Union Hospital in Lynn secured contracts for 2 bargaining units. Some members won their first union contract ever, following a year-long roller coaster ride of negotiations between management and the recently organized members. Together, we rallied community and political support to achieve this key victory on the North Shore. 1199 SEIU members have been tireless advocates for for fair reimbursement rates for healthcare and long-term care facilities. On May 12th, union members held our largest advocacy day ever. Elected officials at the State House were shown that 1199 SEIU members are a force to be reckoned with. And this fall, member political organizers worked hard throughout the election season to help elect candidates who would be strong advocates for working families. Across the state, members held forums to interview candidates for elected positions. 1199 SEIU members engaged these candidates and asked them tough but important questions. Thanks to the work of 1199 SEIU members, Question 3 on the state ballot, an initiative that would have devastated funding for healthcare jobs, was defeated. In the governor's race, the hard work of members helped re-elect our endorsed candidate, Deval Patrick, who was rated highest by members at the candidates forum. Thanks to the governor's support and the organizing efforts of current PCAs, 1,800 new personal care attendants joined our union. Meanwhile, every other candidate for statewide office in Congress endorsed by 1199 SEIU members also prevailed in their elections. On January 12th, when an earthquake struck Haiti, members mobilized on behalf of our Haitian brothers and sisters and set up a crisis center at the Union Hall in Dorchester. The center allowed members of the Haitian community to receive grief counseling, make phone calls, and receive updates on the tragedy in the country. At Marine Biological Laboratory in Woods Hole, 8 housekeepers successfully convinced management not to outsource their jobs. Due to their union strength, these 8 housekeepers kept their pay and benefits. And just last week, on November 4th, 700 workers voted to join 1199 SEIU, the largest organizing vote for any union in Massachusetts in 2010. Workers at Avery Manor Nursing Home in Needham, Fairhaven Nursing Home in Lowell, Heritage Assisted Living, and Harborside Nursing Home in Wakefield also organized to join our union in 2010. As we look back on our accomplishments in 2010, we also are preparing for the challenges of 2011. 1199 SEIU members will continue to lead, grow our strength, and win at the bargaining table in tough times. Together, we are working to make sure that healthcare, home care, and long-term care workers are treated with the dignity and respect that we deserve. Together, we will overcome the challenges of the coming year and continue making strides toward achieving economic and social justice for working families.